The last day of February each year marks Rare Disease Day. It's estimated that 30 million Americans have a rare disease, so scientists and families want to raise awareness. Dr. Malika Marshall has one family's story.
Marbles drop.
I want to pick that red one right there.
Joey Tanella is a typical 8-year-old boy having fun with his parents and sister.
I like to do homework, eat lunch, and snack.
He's among the millions of people in the U.S. living with a rare disease diagnosed at just 2 days old.
The doctor called me and they said we have to immediately bring Joey to the hospital. We had to immediately stop feeding him. During those days, his organs were failing. Essentially, his liver was failing.
Joey has galactosemia, which occurs in about 1 in 50,000 births. The rare genetic metabolic disorder is life-threatening because it affects the body's ability to process a sugar called galactose. The only treatment is to avoid foods that contain galactose or lactose found in all dairy products.
We believe that most of the babies that are not recognized in the newborn period don't survive.
All babies in the U.S. are now screened for galactosemia, but Dr. Jared Berry at Boston Children's Hospital says even with early diagnosis and a restricted diet, patients can still suffer speech and motor skill delays and learning problems.
The goal of all of our research now is to try to understand what causes this and how we can improve the lives of these patients.
There are about 7,000 rare diseases in the U.S., and many of them, like galactosemia, have no FDA-approved treatments. That's something that researchers and families are hoping will change with more awareness and funding.
He does have developmental delays associated, primarily being speech.
The Tanellas say Joey's rare disease is just a part of who he is.
Joey is a hard worker. He loves running. He's very athletic. He doesn't give up, and I think he actually made both of us better people.
We want him to have the best possible life that he can, and he's having that right now.
They hope sharing their story will help other families with rare diseases feel less alone. Dr. Malika Marshall, CBS News, Boston.
And a disease is considered rare in the U.S. if it affects fewer than 200,000 people.